My name's Amelia Jernigan. I am the section chief of GYN oncology at LSU. I'm also the medical director of cancer services at University Medical Center in New Orleans and the interim service line chief for LCMC Health right now. So as a GYN oncologist, I do surgery, I give chemo, I do some preventative care, survivorship, palliative medicine. I wear a lot of hats, but my most important hat is this little guy. So this is Robbie. He's my 5-year-old, and he is interested in dinosaurs, everything in the Marvel universe, but Batman's also cool. And he is just the light of my life. And so a lot of times I think as a parent, as a working mom, I often get questions about, is it hard to work so hard and then, be away from your kid? But here's the thing about Robbie. Robbie's also a Louisianan. And as I get to know him as he grows up, I don't know if he's ever going to be anything else. I mean, this kid thinks Mardi Gras is the best thing in the world. He likes festivals. He likes costuming just on a random Tuesday. So I don't know if he's going to ever do anything else. And I love that he loves Louisiana because I am not a native, but I'm like a no zealot, like a convert Louisianan. I came here, I did Tulane for college, absolutely fell in love with New Orleans and Louisiana, left, did all my training elsewhere, and was so excited to come back. And having the opportunity to do the first 10 years and hopefully the rest of my career here in Louisiana has been a really great honor. But having a child who is in Louisiana and knowing what I know about the health care in the state and the chances that he will be touched by cancer a little bit more than anyone else, or the chances that the people he knows, or even if he gets cancer, he may not have the outcomes that I would hope he would have or the access to things that he would have, has made doing my work even more meaningful. So healthcare is really, really, really complicated right now. And it's more complicated in Louisiana. You guys are very familiar with the challenges we face. The financial toxicity of the care we deliver is a big problem. It's a problem for our patients who have to pay out of pocket for all kinds of things and irregular things, and even to just get threatening letters that they might have to pay an absurd amount of money. But it's also really not sustainable just as a society. So our whole system is completely burdened. As we have advanced in terms of the care that we can provide our patients, it's more complicated. So it's not as simple as it used to be. You might have had 1 or 2 lines of chemotherapy, very predictable toxicities, and then, you went on hospice and you were done. Now we have all these interesting, novel targeted therapies and strange toxicities, and we need all these ancillary services, and survivorship is a bigger deal than it ever was, because if people are living longer, then we also have to make them live longer and healthier lives. But navigating our healthcare systems is, to be frank, terrible. There's just a lot of red tape, and it's very confusing. We are dismantling some of the important structures and institutions that have been put up to prevent and treat patients with cancer. And I think, some of this may be based on a goodwill effort to try to simplify things, but we have to be very thoughtful in how we untangle these messes that we have. The just bomb it approach may not be appropriate, because if you're going to do that, you just need to understand that there are patients that you are going to be disrupting who are on active treatment. And I think we all know that people don't trust us like they used to. We were just at the table talking about vaccines, and I just saw an article the other day that the vaccination rates are declining. I'm personally concerned. I see so much cervical cancer here relative to my colleagues throughout the country. They think it's so interesting that I see so much cervical cancer. We have several cervical cancer clinical trials open at LSU, and I'm very proud, and it's made it easy to make a career name for myself enrolling on those trials at high rates. But I really would prefer that we weren't the highest enrolling site on these cervical cancer trials, because that disease is entirely preventable with vaccines. So I think we have to ask ourselves, why are people refusing vaccines? And why are they turning away from effective medical treatments? And again, I think it's because maybe we aren't making healthcare as pleasant of an experience as perhaps it should be. I often remind my residents that our patients don't want to be in the hospital. Like, they're not here to bother you. They would rather be doing almost anything else. And then physician burnout. I think as these healthcare systems and structures and payment models and patients' issues become more complicated and meeting their needs becomes more complicated, as physicians, we all run into an issue with burnout, and it's a big problem. But still, it's better to light a candle than curse the darkness. And so I think this is where CAGLA has come in. So I was doing interviews yesterday for the B-roll media stuff, And I kept asking people, what makes CAGLA different than, other conferences that you've attended? And the thing that kept coming up over and over and over again was the relationships and the people. And I think that's a really important point because this is a really unique conference. We have people from every walk of cancer life here, right? So we have nurses, we have, PT, we have patients, we have advocates, we have physicians, we have industry. We have, people who work in the legislature. So, we have a lot of different voices at the table. And I think that's really important because to allude back to what we were talking about, patients not trusting us, I think part of it is that we have gotten so sophisticated that we're not speaking a language people understand. It's not familiar. It doesn't seem friendly. Organizations like CAGLA enable us to interface with those patients in a more meaningful way. Industry partners are really important to what we do and may in the very near future be more important than ever. We're not sure how much federal funding we're going to have to do the research that we want to do. And so we're going to lean into industry to make sure that we keep driving what we can do forward and make sure that those advancements get to every patient no matter what. Our patients, and in the bottom corner you'll see Lynn Natkin. Many of you knew her. She passed this year, but she was very involved in CAGLA and very involved in cancer advocacy in the region and was a good personal family friend and patient of mine for a long time. These patients, these are the people who are going to link us to the community and link our message to the community and make sure that people understand that we care about them. Because at the end of the day, you can be the smartest person in the room, you can be absolutely right about everything, but if you can't get your message across because people don't believe you care about them, you're going nowhere with that message. And I think that's been the really fun thing about getting involved with CAGLA several years ago is that it doesn't matter the institution or the school or the hospital or the walk of life from whence you come, everyone at CAGLA is committed to the same mission, which is advancing cancer care because we care about our community, we care about the people who live in it, and we want them to live happy lives and not be so touched and affected by cancer if at all possible. And the other thing that I think is really cool, and I say this having not trained, again, I did Tulane for college, I left, I did all my training elsewhere. I wasn't really sure what kind of scientific advancements were going to be happening anywhere. We're not really, Louisiana's not known for, their cancer research. I'll tell you, at this conference, the last couple of years since they've had the abstract competition, I've been so impressed. There's a lot of really great stuff happening right here in Louisiana, and that's really reassuring to me and for Robbie and his future is that we've got some of the brightest minds right here. So we just need to believe in ourselves. We can do it. And then I think we need to rethink how we deliver healthcare to our patients. And so I'll give you an example. I have the great privilege of working at the Cancer Center at University Medical Center. We have a nutritionist who, a team that opened one of the very first food banks in a cancer center. We used to have a no-show rate of 40%. When they opened that food bank, they brought it down. Our no-show rate is now at 7%, and for our food bank patients, it's at 3%. So these are the patients who should not be showing up. They have transportation difficulties. But if you tie their care to something basic like food, you can make a big difference. So if we can rethink how we deliver our care, we can make a big difference in people's lives. And then, I think that Dr. Matrana's thought behind the Louisiana Cancer Endowment is really important. It's important that we think about being self-sufficient as a state and as a community, and that we grow our solutions to our problems here. This is our community. These are our patients. These are our family members and our loved ones. I think, LSU is working on an NCI-designated cancer center, and we're going to loop in our partners at Tulane. And so the idea that we might have an academic medical center with 2 medical schools, it's just going to be revolutionary. And on the national, international scale, it's going to be a big deal. So we have a lot of promise. And groups like CAGLA, they basically remind me that it's all about the relationships, it's all about the people, and we have that here in Louisiana. So without much more ado, thank you for having me, and you'll have a good rest of the day.